Also, we know that people with their different type of kidney disease, and also in our everyday practice, we use a lot of antibiotics. And we also decided to test this idea how the different types of antibiotics, and we use the combination of ampicillin and metronidazole and also ceftriaxone per se, how it will affect the number of obligate and facultative oxalate. And as you can see here, the obligate oxalate just disappeared even in 1 day after the antibiotics withdrawal, but the number of facultative oxalate gradually decreased and was not restituted even in 56 days after the antibiotics withdrawal. And since it's really complicated to check, and it's not widely used, we thought about the clinical application, about the results. We decided to adapt the method, which can be easily introduced to the clinical practice, and just avoid their culturing for the oxalate degrading bacteria and checking their number, but just check by one step the activity of oxalate degrading activity of entire microbiota in feces. And here you can see the list of widely accepted methods. They are good, they are precise, but they are very expensive, and they need some special equipment and trained specialists to run this method. And we just adjusted very commonly used method of potassium permanganate to check the total oxalate degrading activity in the feces. And we were surprised, but this method appeared suitable to measure the total ODA in fecal biopsy, even at high concentration of oxalate. And we tested both clinically and in experimental settings. And we found for the first time that after antibiotic treatment with the ceftriaxone, okay, so the orange, this is the ceftriaxone, and blue, this is the vehicle. We observed on the 1 day after the ceftriaxone treatment, we observe even upregulation of level of ODB. Despite of this, the activity of this bacteria was significantly decreased, and this level was didn't reach their normal level even after the 57 days after the antibiotic withdrawals. And these changes was also associated with significant increase the concentration of oxalate in the urine, which is a pure confirmation of hyperoxaluria. And we started to think how we can help, how we can introduce this in practical settings, out the results, we decided to go with the already available on the market, the probiotic and symbiotic supplementation. And here you can see the 4 different types of, 3 types of probiotics and 1 type of symbiotic, which are used for as a prophylaxis with antibiotic therapy for the people with their kidney diseases. And we decided to check first, to be more efficient, how this probiotic will degrade oxalate. So we check the oxalate degrading activity of probiotic per se before they are injection to the animals. And as you can see here, the most active symbiotic was their symbiotic, which is multi-species. It contains 4 strains of Lactobacillus, 2 strains of Bifidobacterium, and also Saccharomyces boulardii, and also Selenium, oligofructose, and inulin. And also, if we compare these probiotics with increased number of species, the activity increase. So we, of course, obviously, we decided to go with this symbiotic because in our experimental settings, it showed the best results. And we designed the experiment. We had 4 groups, and we treated the vehicle, and we had the groups treated just with symbiotic and also antibiotic ceftriaxone for 14 days, and also the ceftriaxone plus symbiotic. And here you can see how the results. I like them very much, and they were recently published in the uroteliasis with a very mild changes. And as you can see here, then in comparison to vehicle, the ceftriaxone, as I mentioned before, increased the number of oxalate-degrading bacteria. The same we observe for the ceftriaxone plus symbiotic treated group. But then we go and check on the oxalate-degrading activity. We can see that ceftriaxone significantly decreased this activity in comparison to vehicle-treated rats, and symbiotic per second increase the oxalate-degrading activity. And of course, it was really very efficient to prevent this devastating effect of ceftriaxone on the oxalate-degrading activity. And of course, since we have to think not only about the intestine, we have to think about the kidney, because this is the main organ which participates in oxalate homeostasis. We check on the concentration of oxalate in urine and also in the plasma. Of course, in plasma, we checked at the autopsy on the 57 days after the antibiotic and symbiotic withdrawal. But for concentration in urine, we were able to check in 2 points in 1 and 57 days. And as you can see here, the ceftriaxone significantly, in comparison to vehicle, increased the concentration of oxalate in urine. And ceftriaxone and symbiotic treatment prevent this increase. And also we observe that level of oxalate in the plasma also was increased in ceftriaxone treated group, and the symbiotic improved this concentration. And also to translate all the results to the clinical settings, of course, we wanted to check this method will work for the humans or not. And of course, it's really hard to run the clinical experiment, and we had the excess to their feces samples from the 12 healthy volunteers, which had hyperoxaluria naturally, and 12 healthy volunteers with non-hyperoxaluria, so the level of oxalate in urine was normal. And also we had 70 patients with anuria, which were on hemodialysis, and this group was also interesting for us. And what we discovered that oxalate degrading activity was the highest in the 12 healthy volunteers with the normal level of oxalate in urine, in comparison to the groups of volunteers and patients with hyperoxaluria or anuria per se. And also we found the positive correlation between the oxalate degrading activity and plasma level of oxalate. So we have some results which we hope will be translated in the clinical practice because it helps us to personalize treatment and also to prescribe the patient the right probiotics. So we confirm the total fecal oxalate degrading activity, but not the number of oxalate degrading bacteria, should be thoroughly tested in the future to develop predictive diagnostic methods, targeted prevention and personalized treatment in kidney stone disease. Also, the total fecal oxalate degrading activity determination could be an innovation tool for clearly delineating the need for the probiotic or symbiotic prescribing in a particular patient, and maybe there are conditionally healthy people with a high level of oxalate can be also prophylactically taking the probiotics with a high oxalate degrading activity to prevent the kidney stone disease in future. And of course, we think that if we started to check the metabolizing activity of probiotics which clinically used and personalize them because of the pathology, this is the future of the probiotic therapy. And this increase the clinical efficiency and provide cost-effective targeted prevention. Symbiotics might be useful for more targeted kidney stone disease prevention due to their beneficial effect on total oxalate degrading activity in fecal microbiota, even then used simultaneously with ceftriaxone. And also the probiotic or symbiotic prescribing in patients with hyperoxaluria or calcium oxalate lithiasis makes sense as a person-tailored approach to providing conditions for the restoration of the intestine biocinosis and stimulation of oxalate degrading bacteria activity. And last but not least slide, this is our team. And I really appreciate our collaboration with the Institute of Nephrology, National Academy of Medical Science, in particular, Professor Natalia Stepanovna. And we done a lot of studies and published these results, and also our team from the Taras Shevchenko National University, and the main person who produce most results. It was a PhD student, Irina Kulinka. She is right now already not a PhD student, but a PhD. And also, I would like to say thank you, Dr. Tatiana Sergeychuk, who was in charge for all microbiology study, and all the students, Margarita Skavarodka and Makedon Yelizaveta. Thank you very much.
Thank you, Professor, for so amazing presentation, for so pioneering data and innovative approach for the treatment of so debilitating diseases, and widely one of the most one of the kidney diseases with highest morbidity, And we have a question.